Welcome to the AHIMA CCS Practice and Study Guide 2026. Are you ready to pass your medical coding exam on the first try? In this video, you will learn the most important coding rules, exam tips, and practice strategies to help you succeed. Medical coding means translating doctor notes into medical codes, so hospitals and providers can get paid correctly. Before choosing any code, always read the complete medical record carefully. Missing important details can lead to wrong coding, payment issues, or even legal problems. One of the biggest topics on the CCS exam is diagnosis coding. The main reason the patient was admitted is called the principal diagnosis. Other conditions are called secondary diagnoses, but you only code them if they affect treatment, nursing care, or testing during the hospital stay. For diagnosis coding, coders use the ICD-10-CM book. Start with the alphabetic index, but always confirm the final code in the tabular list. Never code directly from the index, because the tabular list contains important instructions, including seventh characters that describe the type of visit or encounter. For inpatient procedures, hospitals use ICD-10-PCS codes. Every PCS code has 7 characters, and each character has a special meaning. You must understand root operations like excision, resection, and bypass. Excision means removing part of a body part, while resection means removing the entire body part. You also need to understand approaches. Open means the surgeon cuts through the skin, while percutaneous means entering through the skin with a needle or small instrument. If no device remains inside the patient, the device character becomes Z. For outpatient procedures, coders use captain codes. CPT codes usually contain 5 numbers and may require modifiers. For example, modifier 50 means the procedure was performed on both sides of the body. Missing modifiers can cause payment problems. Medical terminology, anatomy, and pharmacology are also extremely important. Understanding word roots helps you identify diseases and procedures. For example, itis means inflammation, so appendicitis means inflammation of the appendix. Never guess when documentation is unclear. Always query the provider for clarification. Coding must always be based on written documentation. If it is not documented, it did not happen. During the CCS exam, stay calm and manage your time carefully. If a question takes too long, mark it and come back later. Make sure you use the correct 2026 code books, because coding guidelines and codes change every year. Practice daily, review the official coding guidelines often, and keep improving your speed and accuracy. The more charts and questions you practice, the more confident you will become on exam day. Now get ready for the first set of CCS practice questions. Read carefully, think critically, and learn from every explanation. If you enjoyed this video, make sure to like, subscribe, and turn on notifications for more CCS exam practice and medical coding training videos. Also check the course link in the description below for full study materials, practice tests, and exam preparation resources. Good luck on your AHIMA CCS journey. 1. What does the principal diagnosis mean when you are coding an inpatient hospital stay record? It is the main condition established after study, to be responsible for the patient admission. This rule comes directly from the guidelines, and it controls how the hospital gets paid. 2. How many characters does a standard ICD-10-PCS procedure code always have in total? Every single PCS code must contain exactly 7 characters to describe the complete medical procedure. Each character position represents a very specific aspect, like the body system and root operation. 3. When should you apply a modifier 50 to a medical procedure code during your exam? You apply it when the exact same procedure is performed, on both sides of body. Adding this modifier ensures the doctor gets paid for both sides, instead of just one. 4. If a patient comes in for a routine checkup, what kind of code do you use? You must use a Z code, which describes an encounter for general medical health services. Z codes are used when a person is not sick, but still needs medical care. 5. Which coding book is used to report outpatient doctor visits and small outpatient clinical procedures? The CPT code book is used for reporting all outpatient procedures and professional doctor services. CPT codes are usually 5 numbers, and they are required for all Medicare outpatient claims. 6. What is the root operation for cutting out a small piece of a patient liver? The root operation is called excision, because only a portion of the body part is removed. You only use the word resection if the doctor cuts out the entire patient organ. 7. What happens if you sequence the secondary diagnosis before the principal diagnosis on a claim? The claim will be denied by insurance, or the hospital will be paid the wrong amount. Sequencing rules are strictly enforced to ensure accurate reporting of the primary hospital patient care. 8. Why must you always check the tabular list after using the alphabetic index for diagnoses? The tabular list provides extra instructions, like adding a 7th character for the specific encounter. Coding only from the index leads to errors, because you miss the final instructional notes. 9. What does the present on admission indicator N tell the health insurance company billing department? It tells them the patient did not have this condition when they entered the hospital. Tracking this helps hospitals avoid penalties for conditions the patient caught while in their care. 10. When a doctor removes a diseased appendix completely, what root operation should you select today? You must select resection, because the doctor took out the entire physical body part completely. Resection means total removal, while excision means cutting out only a small piece of tissue. 11. Which character in an ICD-10-PCS code tells you about the specific medical device? The 6th character is always used to describe any medical device left inside the patient. If no device is left inside the body, you simply use the letter Z instead. 12. What action should you take if the doctor handwriting in the medical chart is confusing? You must query the provider to clarify what they actually mean in their written notes. You cannot guess the diagnosis, because medical coding must be based on clear written facts. 13. How does the 7th character function in the ICD-10-CM medical coding system? The character A indicates an initial encounter, where the patient is receiving active medical treatment. You use this for the first doctor visit, or when active surgical care is happening. 14. What does the medical term tachycardia mean when you read it in a patient chart? Tachycardia means the patient has a very fast heart rate, which requires careful medical monitoring. Understanding medical terms like this helps you locate the correct diagnosis code in the book. 15. If a patient is admitted for dehydration due to vomiting, what is the principal diagnosis? Dehydration is the principal diagnosis because it is the main reason for the hospital admission. The vomiting is a symptom, and the dehydration is the condition needing immediate intravenous fluids. 16. What is the main purpose of using HCPCS Level 2 codes in medical billing offices? They are used to bill for medical equipment, ambulance rides, and drugs given to patients. CPT codes do not cover everything, so HCPCS codes fill in the missing medical gaps. 17. Why is anatomy an important subject for a person taking the AHIMA CCS certification test? You must know where organs are located to select the correct body part character accurately. Without knowing basic human anatomy, you will fail to build accurate procedure codes every time. 18. What does a Y indicator mean for the present on admission medical billing hospital field? It simply means the disease was already active when the patient walked into the hospital. This confirms the hospital did not cause the illness, so they get paid properly today. 19. Which book should you study the most to master outpatient procedure coding for your exam? You must deeply study the Captain Code book to master all outpatient doctor service codes. The exam tests your ability to use CPT guidelines for evaluating correct outpatient surgical procedures. Please check the video description below to get the full course and the complete PDF. Section 2. We are going to learn together about outpatient coding rules right now. Outpatient simply means the sick patient leaves the hospital on the same day. This is very different from the inpatient rules that we learned before. For these quick hospital visits, we use the Captain Code book mostly. The CPT book is filled with 5-digit numbers for different services. These numbers tell the insurance company what the doctor did during the visit. If a doctor cuts off a skin mole, there is a CPT code. You must read the doctor notes carefully to match the exact procedure code. Sometimes, a medical procedure needs a little bit more specific explanation added. This is exactly when we use a modifier to change the code slightly. A modifier is just two numbers attached to the main medical procedure code. We talked about modifier 50 earlier, which means both sides of the body. Another good example is modifier 59 for a distinct separate medical procedure. You use this when a doctor does two things that are usually grouped. It tells the health insurance company to pay for both of the separate things. Evaluation and management codes are a huge part of the outpatient medical world. These codes describe regular doctor visits when you just go talk to them. You must look at medical decision-making to pick the right code level. Medical decision-making basically means how hard the doctor had to think. If a patient has a simple cold, the decision-making is very easy. The doctor will pick a lower code because it requires less mental work. If a patient has severe heart failure, the decision-making is much more difficult. The doctor will use a higher code to get paid a little more money. You must practice reading visit notes to find out the correct level of thinking. Another big topic is medical necessity, which means a valid reason for patient care. The health insurance will not pay if the service is not medically necessary today. The diagnosis code proves the medical necessity for the specific CPT procedure code. For a quick example, you cannot bill a broken leg cast for a sore throat. The broken leg diagnosis must clearly match the application of the heavy leg cast. This is called linking the codes, and you must do it very perfectly always. If the codes do not correctly link, the computer billing system will reject your claim. There is a special rule for outpatient diagnosis coding that you must always remember. You cannot code probable or suspected conditions in the outpatient medical hospital setting. If a doctor says suspected asthma, you only code the actual symptoms they have. You would code the cough and wheezing instead of the unconfirmed asthma lung disease. This is very different from inpatient coding, where suspected conditions can be correctly coded. Outpatient coding requires absolute facts, so you must stick to what is fully known. If the test results come back positive later, then you can finally code asthma. Always follow the official rules exactly, to keep the medical hospital out of trouble. 20. What does the term outpatient mean in the medical hospital billing world? It means the patient receives care and goes home on the same exact day. Outpatient visits are usually much shorter, and they have entirely different medical coding rules. 21. Which coding manual do we use to report outpatient doctor visits and surgeries? We mainly use the Captain Code Book to report all of these outpatient services. This book contains 5-digit numbers, which describe the specific work the doctor performed. 22. What is the purpose of adding a modifier to a CPT procedure code? A modifier provides extra specific details without changing the main definition of the code. It helps the insurance company understand if there was a special circumstance during surgery. 23. When should you apply modifier 59 to a medical procedure claim form? You apply it when the doctor performs a totally distinct and separate medical service. This tells the billing computer system that the two procedures should not be grouped together. 24. What are evaluation and management codes used for in the outpatient coding system? They are used to bill for standard doctor visits and general medical patient consultations. These codes focus on the history, physical exam, and the overall medical decision-making. 25. How do you determine the correct level for an evaluation and management visit? You must review the medical decision-making to see how hard the doctor worked. A very complex patient disease will naturally require a much higher level visit code. 26. What does the term medical necessity mean when you are coding patient charts? It simply means there is a valid medical reason to perform the specific test. If a service is not medically necessary, the health insurance company will deny payment. 27. How do you prove medical necessity for a specific CPT procedure code today? You must link the procedure code directly to a matching patient diagnosis code perfectly. The diagnosis tells the exact reason why the doctor had to do the surgery. 28. Can you code a suspected medical condition in an outpatient hospital clinic setting? No, you cannot code any suspected or probable conditions during an outpatient clinic visit. You must only code the exact signs and symptoms that the patient currently has. 29. If a doctor suspects pneumonia for a coughing patient, what do you correctly code? You only assign a diagnosis code for the cough symptom the patient actually has. Outpatient rules clearly forbid us from coding a disease that is not fully confirmed. 30. How many numbers make up a standard CPT procedure code in the coding book? A standard CPT code is always made up of exactly 5 numbers in total. These numbers are very organized by the specific body system and the surgical method. 31. What should you do if the doctor forgets to sign the medical visit notes? You must ask the doctor to sign the notes before you code the chart. An unsigned medical record is not legally valid, so you cannot bill for it. 32. Why is linking the diagnosis and procedure codes so important for hospital billing? Linking proves the medical necessity and guarantees the hospital will receive a fair, correct payment. A mismatched diagnosis and procedure will cause an immediate rejection from the insurance computer. 33. What type of code is used to report an annual healthy physical exam visit? WERS a specific Z code to show the patient is completely healthy today. Z codes are great for routine checkups when there is no active illness present. 34. What is the biggest difference between inpatient and outpatient diagnosis coding rules today? Inpatient allows coding unconfirmed diagnoses, while outpatient strictly requires coding only confirmed medical facts. This major rule difference is tested very heavily on your medical coding certification exam. 35. Which section of the Captain book contains codes for routine office visits and consultations? The Evaluation and Management section holds all the codes for routine doctor office visits. These codes are located at the very front of your Captain Medical Coding book. 36. What happens to the hospital claim if you forget to add a required modifier? The claim will process incorrectly, and the hospital will lose a lot of money. Modifiers are very critical for getting paid, because they explain special unusual surgical circumstances. 37. If a patient is treated for a broken arm, where do you find the code? You will find the correct diagnosis code in the ICD-10-CM code book. The ICD book handles all the patient injuries, sicknesses, and general health medical conditions. 38. Why do we need to study the medical decision-making process for doctor visits? It tells us how much mental effort the doctor used to treat the sick patient. More mental effort means a higher code, which results in a larger insurance payment. We have reached the end of Section 2 for our medical coding study guide. Please check the video description below to get the full course and the complete PDF. Section 3, we are going to talk about money and how hospitals actually get paid correctly. Hospitals use a very special payment system, which is called diagnosis-related groups. This system groups sick patients together based on their similar medical conditions and treatments. If 2 patients have the same surgery, they will likely fall into the group. The hospital gets a single flat payment for every patient inside that specific group. This flat payment covers the room, the food, and the general nursing care provided. You must code the chart correctly, so the patient lands in the right group. If you pick the wrong diagnosis code, the hospital might lose a lot of money. Some secondary diagnoses are very severe, and they can increase the hospital payment amount. We call these severe conditions complications, or major complications and comorbidities in the field. A complication is a new problem, which happens after the patient enters the hospital. A comorbidity is a severe disease that the patient already had before they arrived. For example, if a patient has severe asthma, they need a lot of extra care. This extra care costs the hospital money, so the insurance pays a higher amount. You must always check the medical record to see if these extra conditions exist. Remember, you cannot just guess if the patient has a major complication today. The doctor must clearly write down the diagnosis inside the official hospital medical record. If the doctor writing is messy, you must send a query to ask them directly. You also need to know about the principal procedure for inpatient hospital billing claims. The principal procedure is the main surgery that treats the principal diagnosis condition. Sometimes a patient has multiple surgeries during a single stay at the local hospital. You must sequence the principal procedure first to ensure the payment calculates very accurately. Diagnostic procedures are done just to figure out what is wrong with the sick patient. Therapeutic procedures are done to actually fix the problem or cure the patient illness. A therapeutic procedure will always be sequenced before a simple diagnostic test or procedure. If you mix up the sequence, the hospital will get the wrong flat payment. This is why the AHIMA exam tests your knowledge on sequencing rules very heavily. You will see many test questions asking you to put the codes in order. Always take a deep breath and read the coding guidelines to find the correct answer. The guidelines will tell you exactly which surgery code must be listed first today. Another big part of the payment system is the present on admission indicator rule. If a major complication was not present, the hospital might not get extra money. Insurance companies do not want to pay for mistakes made by the hospital staff. If a patient falls out of bed, the hospital pays for that extra treatment. You must track these indicators perfectly to keep the hospital billing records totally honest. This protects both the sick patient and the overall healthcare system from bad fraud. We will now move to the questions, so you can practice these new rules. Read each question very carefully, and then look at the detailed explanation provided below. 39. What does the acronym DRG stand for in the inpatient hospital billing payment system? It clearly stands for diagnosis-related groups, which determines the hospital flat payment amount. Patients with similar diseases are grouped together to calculate a fair and standard payment. 40. How does a major complication affect the final DRG payment for a hospital stay? A major complication increases the payment because the hospital must provide much more care. Sicker patients require more nursing staff time and more expensive medicines to get better. 41. What is the exact definition of a comorbidity in the medical coding billing field? It is a severe pre-existing condition that the patient had before admission today. These older diseases often make the current hospital treatment much more difficult to manage. 42. Why must the principal procedure be sequenced first on the hospital medical billing claim? It must be listed first because it drives the grouping and the final payment. The computer looks at the first surgery to decide how much the hospital receives. 43. What is the main difference between a therapeutic procedure and a simple diagnostic procedure? A therapeutic procedure actually fixes the illness, while a diagnosticone only identifies it. Fixing the problem requires more surgical effort, so it is ranked higher in sequencing. 44. If a patient has both types of surgeries, which one do you sequence first? You must always sequence the therapeutic procedure before the simple diagnostic test or surgery. The official coding guidelines clearly state this rule to ensure accurate hospital financial payments. 45. What happens if a patient gets an infection from a dirty hospital surgery room. The hospital will not get extra money because they caused the preventable new infection. Insurance companies penalize hospitals for bad care by refusing to pay for these mistakes. 46. How does the present on admission indicator help the insurance company process the claim? It tells the insurance company if the hospital caused the new complication or not. This small letter prevents the hospital from unfairly profiting off of their own mistakes. 47. Can you add a complication diagnosis code if the doctor did not write it? No, you can never add a diagnosis without clear written proof from the doctor. You must query the medical provider to legally add any missing information to charts. 48. What is the absolute best way to handle a confusing chart during your work? You should immediately query the doctor to clarify the confusing or missing clinical details. Sending a query protects you from making mistakes and ensures the code is correct. 49. Why is a flat payment used for the inpatient diagnosis-related group billing system? It encourages the hospital to be efficient and to not waste any medical supplies. If the hospital spends less than the payment, they get to keep the extra. 50. What determines the specific payment group assignment for a sick patient admitted to hospital? The principal diagnosis and the principal procedure work together to assign the correct group. The billing software uses these two main codes to calculate the final medical reimbursement. 51. Is a simple cut finger considered a major complication for an admitted hospital patient? No, a cut finger is too minor to increase the overall hospital payment amount. Only severe diseases like heart failure or kidney failure will trigger a higher payment. 52. What do you correctly call a new medical problem that starts after patient admission? We call this a complication because it complicates the expected normal hospital recovery process. The hospital must treat this new problem, which delays the patient from going home. 53. Where can you quickly find the official sequencing rules for your hospital coding exams? You can find these important rules at the very front of your coding book. You must memorize how to use these guidelines to pass the AHIMA certification test. 54. Why do insurance companies care so much about the present on admission indicator letter? They care because it stops them from paying for errors made by hospital nurses. This system forces the local hospital to provide a much safer environment for patients. 55. What does the letter Y indicate on a present on admission hospital billing form? It indicates the sickness was fully active when the patient first walked right in. This letter proves the hospital is not at fault for the specific patient disease. 56. If a hospital performs an unnecessary surgery, will the health insurance company pay them? The insurance will absolutely deny payment because the surgery lacked proper clear medical necessity. Every procedure must be fully justified by a very clear and valid diagnosis code. 57. How do you correctly report a secondary condition that does not affect current care? You must completely ignore that condition and leave it off the hospital billing. Claim. You only code extra diseases if they require more nursing care or are clinical tests. Please check the video description below to get the full course and the complete PDF. Section 4. Welcome back, my friends, to the fourth section of our medical coding study guide. In this section, we will learn about special rules for coding specific types of diseases. These special rules are called the chapter-specific official medical coding guidelines today. You must know these rules, because they tell you exactly how to sequence codes. Let us start by talking about coding for severe bacterial and viral infections. If a patient has sepsis, they are very sick and need immediate hospital care. Sepsis happens when an infection spreads deep into the patient-flowing bloodstream. You must always code the underlying systemic infection first, before anything else today. If the doctor says severe sepsis, you will need a minimum of 2 codes. The first code is for the infection, and the second is for severe sepsis. Severe sepsis means the infection has caused your body organ to fail completely. You must also add a third code to identify the specific failing body organ. Now we will discuss neoplasms, which is the medical word for growing cancer tumors. Coding for cancer is very tricky, because you must know the exact treatment reason. If the patient is admitted just to get chemotherapy treatment for their active cancer, you must sequence the special Z code for the chemotherapy treatment first today. The active cancer diagnosis code is always sequenced second in this specific medical situation. But if the patient is admitted to surgically remove the active cancer tumor directly, you must sequence the cancer first, because the surgery targets the main disease directly. Another important topic is diabetes, which affects millions of sick patients every single year. Diabetes codes are very complex, because they include the specific disease and the complications. You do not need a second code to show the diabetic complication in most cases. The ICD-10-CM book combines the diabetes and the complication into one code. This is called a combination code, and it makes your coding job much faster. If the doctor says type 2 diabetes, with painful diabetic foot nerve damage today, you only look for one single code that describes both of these exact problems. If a patient uses insulin daily, you must add an extra Z code too. This extra Z code tells everyone that the patient requires long-term insulin use. Next we must talk about coding for pregnancy and newborn baby hospital patient stays. Pregnancy codes from Chapter 15 always take priority over all other regular diagnosis. Codes. If a pregnant woman gets a cold, you must use a special pregnancy code. This special code tells the insurance that the pregnancy makes the cold more dangerous. For newborn babies, you use codes from Chapter 16 of the ICD-10 book. Never use a newborn code on the mother-owned personal medical hospital billing chart. The baby and the mother always have totally separate and different medical chart records. When a baby is born, you use a Z code to show the birth location. This birth location code is only used once, on the very first baby record. You must practice these chapter rules, because the exam will test you on them. Reading the coding book slowly will help you remember these tricky sequencing rules better. We will practice these rules right now, with a new set of helpful questions. 58. What is the medical term for an infection that spreads into the bloodstream? The correct medical term is sepsis, which requires immediate and heavy antibiotic hospital treatment. Sepsis is a very dangerous condition that can quickly lead to total organ failure. 59. How many codes do you need when a patient has severe sepsis diagnosed? You need at least 2 codes to properly report the severe sepsis condition today. One code identifies the root infection, and the second identifies the severe sepsis condition. 60. If severe sepsis causes organ failure, what extra code must you also assign today? You must assign a third code to identify the specific organ that is failing. The coding guidelines require you to report all major organ dysfunctions for severe sepsis. 61. What does the word neoplasm mean in the medical coding and hospital billing world? It is the formal medical term for an abnormal growth like a cancer tumor. Neoplasms can be benign or malignant, which greatly changes the selected final diagnosis code. 62. Which code is sequenced first if a patient is admitted solely for chemotherapy treatment? You must sequence the specific Z code for the medical chemotherapy encounter first today. The cancer code is sequenced second, because the main reason is the chemotherapy session. 63. What code do you sequence first if the patient comes for cancer removal surgery? You must sequence the active cancer code as the primary principal diagnosis code today. The surgery directly targets the tumor, so the cancer is the main admission reason. 64. How does the ICD-10 book handle a diabetic patient with a kidney complication? The book uses a single combination code to describe both the diabetes and complication. Combination codes save you valuable time, and they keep the billing claim very clean. 65. What extra code is needed if a type 2 diabetic takes insulin every day? You must add a specific Z code to report the long-term insulin use. This extra code helps the insurance understand the daily medical needs of the patient. 66. Which chapter in the coding book always takes priority over other general medical chapters? Chapter 15 for pregnancy codes will always take priority over other general diagnosis codes. Pregnancy heavily impacts medical treatment, so these codes must always be listed very first. 67. Can you use a Chapter 16 newborn code on the Mother Medical Hospital chart? No, you can never mix up the newborn codes with the mother medical record. The mother and the newborn baby are two separate patients with totally different charts. 68. What type of code is used to report the hospital location of a birth? You must assign a specific Z code to describe where the new baby was born. This birth location code is assigned only on the initial admission record of baby. 69. If a patient has multiple burns, which burn do you sequence first on claims? You must always sequence the burn with the highest degree of severity first today. A third-degree burn is the worst, so it is coded before a first degree. 70. How do you correctly code an injury if the doctor does not know exactly? You must code the injury itself without guessing the unknown specific external medical cause. You should never guess medical information unless the doctor clearly writes it down. 71. What does the term principal diagnosis mean in the inpatient hospital medical coding system? It is the main medical condition that caused the patient to be admitted today. The principal diagnosis code always drives the final financial payment amount for the hospital. 72. What happens to the payment if you forget to code a major complication disease? The hospital will lose a lot of money because the claim is incomplete. Accurate coding ensures the medical hospital is paid for all the nursing care provided. 73. Why must you read the chapter-specific guidelines before taking the AHIMA certification exam? The guidelines provide the strict rules for sequencing tricky diseases like cancer and sepsis. You cannot pass the test if you do not understand these exact sequencing rules. 74. What is the correct way to code a patient with both HIV and pregnancy? You must code the pregnancy first, followed by the specific HIV viral disease code. As we learned earlier today, pregnancy codes always take priority over any other conditions. 75. If a patient is admitted for dehydration caused by severe chemotherapy, what comes first? You must sequence the severe dehydration first, because it is the reason for admission. The cancer and chemotherapy codes will follow as secondary diagnoses on the claim. 76. What should you do if the doctor notes about an infection are very messy? You must send a clear query to ask the doctor for much better clinical details. Sending a query is the safest way to ensure your medical codes are perfectly correct. Please check the video description below to get the full course and the complete PDF. Section 5. Welcome back, friends, to the 5th section of our medical coding course today. We are making great progress, and you are learning very important exam rules. Today we will talk about the radiology and pathology sections of the book. Radiology codes are used to bill for medical X-rays and ultrasound imaging scans. When a doctor takes an X-ray, there are two different parts to bill. First is the technical component, which covers the actual expensive hospital X-ray machine. Second is the professional component, which covers the doctor reading the final image. You must use modifiers to tell the insurance which part is being billed. Modifier TC is used when the hospital only provides the physical X-ray machine. Modifier 26 is used when the doctor only reads the X-ray image. If the doctor owns the machine, they bill the global service without modifiers. Next we will look at the pathology and laboratory section of the book. This section covers blood tests, urine tests, and checking tissue under a microscope. When coding lab tests, you must group panels together to save time today. A panel is a group of specific blood tests done at the same time. If a doctor orders a basic metabolic panel, you use one single code. You should never unbundle a panel into many small individual blood test codes. Unbundling is a bad mistake, and the insurance company will reject your claim. Now let us talk about the medicine section of the Captain Coding book. The medicine section includes things like vaccines and physical therapy for sick patients. When a patient gets a vaccine, you always need two totally separate codes. The first code is for the actual physical liquid medicine inside the needle. The second code is for the nurse actually pushing the needle into arm. If you only code the medicine, the hospital will not get paid fully. We also need to review the ICD-10-PCS root operations again today. Remember that extraction means pulling out a body part using force or suction. A good example of extraction is a doctor pulling out a bad tooth. Fragmentation means breaking a solid body part into much smaller little tiny pieces. Doctors use fragmentation to break up painful kidney stones without cutting the skin. Inspection means visually looking at a body part to figure out the problem. If a doctor starts an excision but stops early, you only code inspection. This is a very strict rule that you will see on the test. You must practice finding these root operations in the code tables every day. Look at the index first, but always build the code in the tables. Never forget to check the character values at the top of the table. Each column in the table must match exactly to form a valid code. If you pick a wrong character, your final procedure code is completely invalid. Take your time, read the operative report, and ask the doctor for help. You must also learn about the National Correct Coding Initiative rules for billing. These rules stop hospitals from billing two codes that should be grouped together. Always check the edits before you send the final claim to the insurance. If two codes have an edit, you might need a special modifier today. This ensures the hospital follows all the federal laws for medical financial billing. Let us move forward now and test your brain with some new questions. 77. What does modifier 26 mean when used on a radiology X-ray code? It means the doctor only read the image and did not own the machine. This modifier pays the doctor for their professional time reading the hospital film. 78. What modifier is used when the hospital provides the physical radiology X-ray machine? You must use modifier TC, which stands for the technical component of service. The hospital gets paid for the machine cost and the electricity used today. 79. What happens if you unbundle a laboratory panel into small individual test codes? The insurance company will deny the claim for using incorrect medical billing codes. You must always use the single panel code to group the tests together. 80. How many codes are required when a nurse gives a patient a vaccine? You must assign two codes, one for the medicine and one for administration. This ensures the hospital gets paid for both the drug and the labor. 81. What does the root operation extraction mean in the ICD-10-PCS book? It means pulling out a body part using physical force or medical suction. Removing a tooth or delivering a baby are very common examples of extraction. 82. Which root operation is used when a doctor breaks up a kidney stone? The correct root operation is fragmentation, because the stone is broken into pieces. The doctor does not take the pieces out, they just break them up. 83. What should you correctly code if a planned surgical excision is cancelled early? You must only code an inspection, because the doctor only looked at it. If the main surgery is not finished, you only code how far they got. 84. Where do you build the final 7-character code for a hospital procedure? You must build the final code using the specific tables in the coding book. The alphabetic index only gives you the first few characters to start searching. 85. What do the National Correct Coding Initiative edits prevent in the billing office? They prevent medical hospitals from unbundling codes that should be billed closely together. Following these edits keeps the hospital out of serious trouble with the government. 86. Why is it very important to check the character values in PCS tables? Picking the wrong character from a column makes your entire procedure code invalid. All 7 characters must correctly align in the same row to work properly. 87. What type of test is found in the Pathology and Laboratory CPT section? You will find blood tests, urine tests, and microscopic tissue exams in there. These codes help doctors figure out exactly what is making the patient sick. 88. If a doctor does a basic metabolic panel, can you code tests separately? No, you must use the single panel code instead of individual test codes. Coding them separately is called unbundling, which is a major medical billing error. 89. What section of the Captain book contains codes for patient physical therapy sessions? The medicine section contains codes for physical therapy and many other non-surgical treatments. This section is located near the very back of the CPT coding manual today. 90. What is the technical component of a medical radiology scan used to pay for? It pays for the physical hospital machine, the electricity, and the technician's salary. The hospital needs this money to maintain their very expensive medical imaging equipment. 91. If a doctor owns the X-ray machine, do they need to use modifiers? No, they bill the global service code without any extra technical or professional modifiers. The global code pays them for both the machine and the visual reading time. 92. What does the root operation inspection mean during an inpatient surgical hospital stay? It means visually looking at a body part without doing any cutting today. Doctors use inspection to explore the area before they decide what to fix. 93. How do you code the administration of a vaccine in a doctor office? You use a specific Captain medicine code to bill for the nurse time. Pushing the needle into the patient arm requires trained clinical staff to perform. 94. What must you do if the doctor operative report is missing key surgical details? You must ask the doctor a clear query to get the missing information. Never guess what the doctor did, because that leads to illegal billing claims. 95. Why must you practice building PCS codes every single day before the exam? Practicing helps you memorize the table structures and increases your coding test speed. The AHIMA exam has a strict time limit, so you must move quickly. Please check the video description below to get the full course and the complete PDF. Section 6 details. Welcome back, friends, to the 6th and final section of our medical coding course. We are going to talk about medical billing compliance and strict hospital ethics. Compliance means following all the rules, so the hospital does not break the law. You must always code honestly to protect the patient and the hospital from fraud. Fraud happens when a hospital bills for medical services that never actually happened today. If you code a surgery that was not done, that is considered illegal fraud. Abuse is slightly different, because it means making silly mistakes over and over again. Both fraud and abuse are bad, and the government will punish the hospital heavily. You must always follow the official guidelines to ensure your coding is totally compliant. Never change a diagnosis code just to get the hospital a bigger financial payment. This is called upcoding, and it is a very serious crime in our field. You must only code what the doctor wrote inside the official patient medical record. If the doctor wrote a simple cold, you cannot code a severe pneumonia infection. Upcoding steals money from the health insurance company and ruins your professional coding career. Another bad practice is unbundling, which we talked about in the last section together. Unbundling means breaking a grouped service into many small parts to get paid more. You must use the National Correct Coding Initiative rules to stop unbundling from happening. These rules tell you exactly which codes cannot be billed together on a claim. If you see a coding mistake, you must report it to your supervisor immediately. Do not hide the mistake, because hiding it makes the problem much worse later. Every hospital has a compliance officer who makes sure everyone follows the federal laws. You can talk to the compliance officer if you see someone breaking the coding rules. We also need to review the external cause codes for patient injuries right now. External cause codes tell the insurance exactly how the patient got hurt today. If a patient falls off a ladder, you need a code for the ladder. You also need a code for the location, like a house or a busy street. These codes do not affect the hospital payment, but they help track public safety. You always sequence the external cause code after the main injury diagnosis code today. Let us talk a little more about the importance of protecting patient health information. The HIPAA law requires you to keep all patient medical records totally private always. You cannot share patient secrets with your friends or your family members at home. If you break the HIPAA privacy law, you can lose your medical coding job. Always lock your computer screen when you step away from your hospital work desk. Do not look at medical records if you do not need them for your work. Looking at famous patient charts for fun is a huge violation of the law. Your job is to read the chart, find the codes, and protect the data. We have covered a lot of information to help you pass the certification test. You must practice reading medical charts and building codes every single day at home. The AHIMA exam is very hard, but you can pass it with good practice. Take your time during the test and read every single question very slowly. When you prepare for the exam, focus heavily on the official coding guideline sequencing. Thetis will try to trick you with very complicated patient medical hospital scenarios. You must identify the principal diagnosis clearly before you look at any other details. Do not let the extra confusing words distract you from the main patient problem. Remember to bring your updated code books to the testing center with you today. Older books have wrong codes, and using them will cause you to fail instantly. I am very proud of your hard work, and I know you will succeed. Now let us finish this course completely with our final set of practice questions. 96. What does medical coding fraud mean in the hospital billing office? It means intentionally billing the insurance company for services that never actually happened. Fraud is a deliberate crime which steals money from the government and private insurance. 97. How is medical billing abuse different from medical coding fraud in the hospital? Abuse involves making careless mistakes repeatedly, rather than intentionally stealing money from the system. Both actions are heavily punished, but fraud requires a clear intent to steal money. 98. What does the term UP coding mean in the medical coding and billing field? Upcoding means assigning a more severe diagnosis code, just to increase the financial payment. You must never UP code a chart, because it is illegal and very unethical behavior. 99. Who should you contact if you notice illegal UP coding in your billing office? You should immediately report the illegal activity to the hospital corporate compliance officer today. The compliance officer protects the hospital by investigating and fixing all rule violations completely. 100. Why does the National Correct Coding Initiative exist in the medical billing world? It exists to prevent hospitals from unbundling codes and overcharging the insurance companies unfairly. You must check these strict edits before submitting any final outpatient surgical claim today. 101. What information do external cause codes provide on a patient medical injury claim? They explain exactly how the patient got hurt and where the accident took place. These codes help researchers track safety issues, like car accidents or dangerous workplace falls. 102. Do external cause diagnosis codes increase the hospital flat payment amount for injuries? No, they do not change the payment amount, but they provide helpful safety data. You sequence them after the main injury because they are just extra informational codes. 103. What federal law protects the privacy of all patient medical hospital records? The HIPAA law requires all hospital workers to keep patient health information completely private. Breaking this privacy law is very serious and can destroy your medical coding career. 104. Can you look at the medical chart of a famous person just for fun? No, you can only open a medical chart if it is strictly required for your work. Unauthorized snooping in medical records is a direct violation of the strict HIPAA rules. 105. What is the most critical step when starting a complex AHIMA exam question? You must first identify the principal diagnosis before reading any other distracting clinical details. Finding the main reason for admission helps you sequence the rest of the codes. 106. Why must you bring the updated code books to your official certification exam? The medical codes change every year, so older books will contain many wrong answers. Using updated books ensures you have the most accurate guidelines for the current test. 107. What should you do if you get stuck on a difficult exam question? You shall mark the difficult question immediately and come back to it much later. Wasting time on one single question will stop you from finishing the entire test. 108. If a doctor writes down suspected cancer, can you code it as inpatient? Yes, inpatient rules allow you to code suspected conditions as if they are confirmed. This rule only applies to inpatient stays and never to outpatient hospital clinic visits. 109. What must you do before you report a major complication on a claim? You must ensure the doctor wrote a clear link between the diagnosis and complication. Without clear written medical documentation, you cannot legally add the extra complication code today. 110. What does the present on admission indicator U mean on a hospital claim? The letter U means the medical documentation is insufficient to determine the exact timing. You should try to query the provider before using this vague indicator letter today. 111. How do you sequence the codes if a patient has two equally severe diseases? The coding guidelines allow you to sequence either one as the principal diagnosis code. This is a rare situation, but the official rules give you flexibility to choose. 112. What root operation describes putting a permanent pacemaker inside a sick patient heart? The root operation is called insertion because a non-biological device is placed inside. Insertion is always used when a non-biological medical device is left permanently inside. 113. How many characters must a valid ICD-10-PCS code have to work correctly? Every single valid inpatient procedure code must contain exactly 7 characters in arrow. If you miss a single character, the hospital billing computer will reject the claim. 114. What is the very last step before you submit your finished medical coding exam? You must review your answers carefully to make sure you followed all the guidelines. A quick final check can save you from making very simple and silly mistakes. Please check the video description below to get the full course and the complete PDF.